All right, so let's look at the posterior upper arm muscles. All right, so let's get started and just name our bones again. Now we're looking at the back of the right arm. And so things are just switched around, but everything is the same as in the anterior videos. So let me label these real quick. This big bone right here is the humerus. And then this big bone right here is the ulna, right here. And this is the radial bone. Remember, the radial bone is more lateral. So this is the right arm. So this, you'd actually be seeing a head here. Well, not right here, but this is the back of the head. So this is the hair, and then a neck. So you can just picture that. So this is the right posterior upper limb. And then this big bone right here is the scapula. We'll be talking about this bone a lot. It's actually connected to, I think, 12 muscles in total. So it has a lot of muscles surrounding it. This loop of the scapula right here is called the acromion. And this bone right here, famous for always breaking, is the clavicle. There we go. I think we have everything here. And just with these bones, we can start talking about the posterior upper arm muscles. Okay, let me clean this up, and then we'll start at the deepest muscles and then go more superficial. I find it much easier to learn that way. So let's go ahead and go into that. Okay, first let's go ahead and start looking at the scapula, because this is going to be the main origin of a lot of the muscles that we talk about in the posterior upper arm. Now there are two major fossas here. One right here, which is the supraspinous fossa, and then the infraspinous fossa right here. And these will be important. The muscle that sits in the supraspinous fossa is the supraspinatus. It is innervated by suprascapular nerve, and it kind of goes all the way through here. Let me just draw this in. And it'll actually go here and right under this process and attach to the superior part of the greater tubercle of the humerus. There you go. Let me just take a second to draw this in. Once again, it's innervated by the suprascapular nerve. And you can actually kind of guess just by looking at this muscle what it does for a function. Now it comes here, right? Originates here in the suprascapular fossa, supraspinatus muscle. Let me actually write that. And it'll pull right here on the arm, right? So this will pull up like that, and it will, let me write it in green, and it will abduct the arm. Which makes sense. It'll pull up here, and then this will come out like that. So it will abduct the arm. Okay, now let's go into the infraspinous fossa. And this fossa houses a muscle called the infraspinatus. Let me draw this in. It comes all the way up to here. Remember, this is infraspinous fossa, and it houses the infraspinatus muscle. And it comes up, it goes all the way up to this portion right here, and actually goes a little bit underneath this, and it goes to the middle part of the greater tubercle. So like that. Just like that. And you can also guess just by looking at this what the function is of this muscle. Let me write it down here first. Infraspinatus. Right here. So supraspinatus, infraspinatus, and we will write the function in yellow. And the function is going to be to laterally rotate. The arm. You can see that by where it's inserted right here. So it's going to pull this way. And if you can imagine this thing, it'll rotate it out like that. Both of these muscles are innervated by the same nerve, the scapular nerve. That's easy. So they're both innervated by the same exact nerve. Okay, let me clean this up, and then we'll go into some more muscles of the posterior upper arm. All right, the next muscle kind of picks up where the infraspinatus leaves off, and it inserts right here on the lateral border of the scapula. So this is where it's important to kind of know what those terms mean, right here, and it'll come up and insert in the lower part of the greater tubercle. So right about here, let me draw this in. And you can also guess the function of this just by the placement of it. And it's right next to the infraspinatus. And this is actually called a teres minor muscle. Let me draw that thing. There you go, right there. And then let's talk about the function of it. So it's going to pull this way, right? And it's going to cause the arm to go this way. And so it's going to do a lateral rotation, which is pretty much the same as the infraspinatus, and which makes sense, right? This is pulling this way, this is kind of pulling kind of in the same direction, and they're both going to cause this humerus to laterally rotate. The next muscle I'm going to draw is actually kind of crazy, and I'm trying to organize it by nerve just to make it a little easier. It actually wraps all throughout here, all the way along this. What they call this is the scapular spine, or the spine of the scapula, and it wraps all the way here, all the way through the acromion. It originates in this whole area, and all the way over to the clavicle. So this whole thing is kind of going in this direction here, and it's just blanketing over your shoulder, this muscle. You can kind of picture it here, and it's almost a whole 360, but not quite. And it inserts right here on the lateral part of the humerus, and it inserts here at the lateral part of the humerus. And we went over this part in one of the videos, and it's called the deltoid tuberosity of the humerus. So let me write that down. This is the deltoid muscle. And the function of this is actually quite easy because it's so big. It's literally wrapping all the way around. It can abduct the arm. So here, let me write these down in green. It can abduct the arm, move it this way. It can adduct the arm, move it this way. It can laterally rotate the arm, like this arrow here. It can medially rotate the arm. It can flex the shoulder, and it can extend the shoulder. So there's not much, and that would be kind of coming at us and going away, but there's not much the deltoid muscle can't do because it wraps all the way around. So as long as you kind of know that it can do almost anything at the shoulder region, I think it'd be okay. Now, as I said, I was trying to organize this by nerve. So both the teres minor and the deltoid muscle, that's kind of blanketing here, and the teres minor right here, are both innervated by one nerve, the axillary nerve. There we go. The axillary nerve. Okay, so let's go into the next set of muscles. Okay, the next muscle we're going to talk about is actually a little bit tricky. This muscle originates on the inferior angle of the scapula. So we said superior angle is up here, inferior angle is here. It originates in the inferior angle of the scapula. It kind of comes around the teres minor, and it's tricky here that it goes anteriorly to the front of the humerus and then wraps around and inserts on the medial intertubercular groove. It's on the lateral part of the humerus we talked about. It's like a little groove right here on the lateral part of the humerus. So it comes around. This is a teres major, right? So this is teres minor right here, and then this is teres major. And it comes around here. It's a little bit bulkier. It's just like the rhombus minor and major, which we'll talk about a little bit later, where the minor is on top and the major is on the bottom, and it comes around here, it goes in front of the humerus and wraps around and inserts right here. Now we will talk about the function of this, which is also can be derived from just the anatomy of the muscle, as always. So when this muscle contracts, you can derive the function here. This thing is going to contract and it's going to rotate because it's wrapping around. Rotate like this. So it'll rotate medially. Right? And then also because it's contracting here, of course, it can pull back so it can adduct the arm as well. Adduct arm, medially rotate. Two functions of the teres major. Let me write the muscle name down for you. It is the teres major. And sits right below the teres minor. There you go, right there. All right, so let's move into the next muscle. And I have to say I'm sorry about this next muscle because you can't really see it. Since we're looking at the posterior scapula, the next muscle I want to talk about is the subscapularis, and it actually sits on the other side of this. It's something called the subscapular fossa, which is literally just a fossa on the back of the scapula. And the subscapularis muscle sits in there. Let me write that down. That is the subscapularis muscle. And it actually originates in the back of this in the subscapular fossa, and it will actually insert into the lesser tubercle of the humerus. So down here we have the teres major. Right next to it is the lesser tubercle, and this is where the subscapularis inserts, and it's actually quite anterior. So it's kind of an anterior insertion. Write that down. Subscapularis. And so that will explain its function in that when it contracts, because it's behind here, it's actually, picture this, connected to a muscle behind this, but it contracts that way. So it will adduct the arm, right? So it will adduct the arm and also cause it to rotate this way, which is a medial rotation. So it's kind of cool that these have the same nerve, which I will write down right now, which is the subscapular nerve. Which is kind of cool because they share the same nerve and they share the same functions. They both medially rotate and they both adduct the arm. So they pull the arm in and they both medially rotate anteriorly. Okay, so let's go into the next set. I think now would be a good time actually to talk about an important set of muscles that make up the rotator cuff. Rotator cuff. And a good acronym for this is the sits muscles with a lowercase t, sits muscles. And they stand for supraspinatus, infraspinatus, teres minor, and that's why you have the lowercase t for the minor part, and subscapularis. Those are important to know because rotator cuff injuries are so common. Now let's go over real quick what kind of things can cause injuries in these muscles. Let me erase this real quick. And in the supraspinatus, that muscle, as if you remember, it wraps around the top here, so it can abduct the arm, right? Let me write this down. It can abduct the arm, pull it out. And the important part to know about that is it actually initially abducts the arm, and then that big muscle that we drew earlier, the deltoid, then picks it up. So it initially abducts the arm when it's low in this position. It'll go here, and then it'll later get picked up by the deltoid muscle. And this one is actually the most common muscle injured in the set. This one's most common. Now, if you remember the infraspinatus, actually, let me erase these, will actually laterally rotate the arm. So it'll rotate it this way, and it will also adduct the arm, so also pull it in. Then if you remember, the infraspinatus muscle will laterally rotate the arm, so rotate it this way, and this one is most injured in a pitching injury. All right, and you can also remember that both of these are also, if you remember, suprascapular nerve. And you should also actually kind of know that these sits muscles are innervated primarily by C5 and C6. There you go. Okay, so now let's go into the muscles of the back of the arm. Okay, so now we have the triceps muscle, and this one has multiple heads, just like the biceps muscle does as well. The first one, just like the biceps muscle, is a long head, and it comes right off the infraglenoid tubercle. If you remember, it's this part right here, and it comes off right off the bottom of that, and it comes down, and all three heads insert into the olecranon process of the ulna bone. So right here, all three heads will end up right here, and this will help extend the forearm. So like that. Let's draw that there. Let me just draw a little bit more here. The next head that comes off of this is the medial head, which comes up and it kind of inserts just inferior to the radial groove of this humerus. So it inserts right about here. And then the last part is the lateral head, which is really just an extension of the medial head, and it inserts on the superior part of the radial groove of the humerus. So the whole thing should look something like this, and it's actually quite a big muscle. Make this a little bit bigger. Comes down like that. And then there's normally a big triceps tendon actually that inserts into this olecranon process. Now let me write down these names real quick. So this one right here on the outside or more lateral is the lateral head. And this is all the triceps muscle, which makes sense. 3 heads, right? Tri for 3 heads. Lateral head. This is the long head, which makes sense because it's the longest one. This is the long head. And then there's also a medial head right here, which is just so hard to see in just about any picture you look at. Medial head. But from what I can see, it's actually just kind of an extension, or at least in the lab, it's really just an extension of this lateral head. So lateral head comes from the superior part of the radial groove of the humerus, and then the medial head picks up on the inferior part of the radial groove of the humerus, and they all go into this olecranon process of the ulna right here, olecranon process. And this is innervated by, let me write that down, this is innervated by the radial nerve. So if you remember, the anterior compartment of the humerus is innervated, the muscles there are innervated by musculocutaneous nerve, and the posterior compartment of the humerus bone, those muscles are innervated by radial nerve. Now this would be important, and we'll talk more about this when we get to the brachial plexus. Now the function of this, if this was flexed, you could imagine it would pull as it contracts this way, and so this extends the forearm. So these, if you know the origin and insertion or generally where they're located, you know that muscle only contracts. So the function of these is kind of intuitive if you kind of know generally where the muscle is. So the muscle starts here, it inserts right here on the olecranon process, and when it contracts, it'll extend that forearm. Okay, so there's one little muscle left that we'll go over real quick. Now this is the last muscle we'll go over, and I'm just doing it really for completeness, and it's quite easy. It actually comes from the lateral epicondyle. If you remember, this right here is the lateral epicondyle, and it actually goes to the olecranon process right here, and that's it. That's all it does. And it's called the Anconeus muscle. see if I can find a place to write it. This is the Anconeus muscle. And the function of this little muscle is actually to extend the forearm. So it's kind of cool that it is a nice pair with the triceps because it helps extend the forearm just like the triceps, and it's also innervated by the radial nerve as well. Okay, so I think that's it for this video. I'll see you in the next one.